So we talked in detail about all the endocrine complications during pregnancy and how they can be managed and how they present. Now let's start talking about some neurological complications during pregnancy. These neurological complications include like multiple sclerosis, migraine, and Bell's palsy. Multiple sclerosis. Multiple sclerosis is a condition in which it's a relapsing and remitting disease. So multiple sclerosis is mainly due to demyelination of the nerve. So myelin sheath, that's a covering protective sheath of the nerve. There is destruction of that myelin sheath. That's called the demyelination. And it is relapsing and remitting disease. And sometimes there are periods of relief. Patient feels completely normal, but then it is also remitting, and it's a continuous phase of relapsing and remitting disease that cause disability through demyelination. Can occur 1 in 1,000 pregnancies. It is autoimmune usually. Excuse me. So it's autoimmune, usually familial disorder, leads to tinnitus and decreased hearing, nystagmus, diplopia, blurred vision, dysarthria, and dysphagia. So all these are common with multiple sclerosis. Tinnitus is the ringing sound in the ear. As a result, there is decrease in the hearing. Cause nystagmus. Nystagmus is the involuntary continuous movement of the eyeball. There is diplopia, double vision, blurring of the vision, dysarthria, difficulty in articulation during speech, and difficulty in swallowing also. How it can affect the bladder. There is urinary retention and spastic bladder, and also there is constipation. So urinary retention is there as a result of urinary retention. Infections and UTIs are common also, and it can also lead to constipation. In the legs, there is weakness that may progress to paralysis, muscle spasticity, ataxia, and vertigo. All these are the complications of multiple sclerosis, and it's relapsing and remitting disease, and it can cause demyelination of the nerves. Multiple sclerosis here, the first line of treatment should be stopped at conception. First line of treatment for the multiple sclerosis are the drugs like glatiramer, interferon beta, and dimethyl fumarate. These are the first line of treatment for multiple sclerosis. Women who are using these drugs and get pregnant, they should be stopped. So they should not be used during the pregnancies, even though it's the first line of treatment. Steroids or IV immunoglobulins can be given. Migraine, another condition or neurological problem that can affect the pregnancy. It's migraine due to tension, most common. Women who suffer migraine before pregnancy, the frequency of attacks drops by 50 to 80% during pregnancy. It increased again in puerperium or the period after the delivery. So most common due to tension, but the important thing and the good thing is the level or the frequency of migraine drops by 50 to 80% during pregnancy, and again it increases in the period after the delivery. Initial treatment of migraine is simple analgesics, avoidance of light, bed rest, various coping mechanisms, and then if these simple or initial treatment measures are not working properly, then we should use more potent analgesics, drugs, migraines. There are special drugs for the treatment of migraine headaches, those should be used. And then we have beta blockers or antidepressants can also be used because tension is one of the leading cause of the migraine. Ergot derivatives contraindicated due to vasoconstrictive effect. Then Bell's palsy. Bell's palsy is incidence increased tenfold during third trimester of pregnancy. Bell's palsy is a condition in which there is drooping of the face to one side. One side is normal, but the other side, the face is drooped downward. One eye is affected also. So all these are the features that are associated with Bell's palsy. There is headache, inability to close eyelid, facial drooping in the corner of the mouth, drooling and changes in amount of saliva produced, and there is pain around the jaw, pain behind the ear, increased sensitivity to the sound. There are changes in quantity of tears produced. So all these are the changes associated or the clinical presentation of the Bell's palsy. It's very good prognosis, Bell's palsy. It can improve with the treatment with the steroids are used. So incidence is increased tenfold in the third trimester of the pregnancy. Corticosteroids and antivirals are used for the treatment of Bell's palsy. That was all about the section in which we talked about the neurological complications and their effect during the pregnancy. Thank you for watching sqadia.com.